Welcome back to another episode behind beliefs and behaviors. I am so excited to be here, and I'm very excited to be here with my colleague, with my friend. We are talking about behind empowered health and wellness today with Dr. Malathi Acharya, and she is the owner of Integrative Medicine. And I am very, very excited to have this conversation because as some of you may know, if you followed me for a while, if you know my background, before I transitioned out of clinical medicine, integrative medicine, that was my jam. That's what I did. And so months ago, we've been leading up to this conversation for a while. And months ago, Dr. Malti and I, we had this amazing conversation where we connected and talked all about integrative and how the system, can sometimes disempower us, and how integrative medicine can bring empowerment back into our well-being, and especially our patients' well-being as well. So I welcome you, Dr. Malathi. Thank you for being here with me. How are you today?
Thank you, Dr. Maisha. I'm doing really great. It's a bright and sunny day over here where I am in the Bay Area, California. And I'm super excited to be here in this podcast with you to talk about a topic that's obviously passion, close to both our hearts.
Yes, yes. Well, I'm looking forward to the conversation. And before we jump in, I always like for my audience to get to know my guests, to get related. And so, would you mind telling us a little bit about yourself, your background, how you decided to go into integrative medicine? Just share a little bit about you.
Absolutely. My name is Dr. Malathi Acharya. I'm the founder of Ayur Integrative Medicine, which is an integrative medicine consultation practice here in the Bay Area. My journey in medicine, or rather my exposure to the medical world, began very, very early for me. My parents are physicians, so
Mm,
I was born into and grew up in a family of physicians in India, and that's what I was exposed to. And it was, growing up, that's the only profession I saw. My parents were,
mm,
what they call as family doctors back in India, and we lived on the first floor of the building and or the second
mm,
floor of the building,
yeah.
here for people here, and my parents had their clinic down on the first floor, so it was like this
Mm,
home clinic, all it was, merged together. um,
nice.
so that was where I grew up, and you know it was, what I saw was that the doctor was not just a doctor, but the doctor was an integral part of the families
Mm,
and the social lives of the people over there.
wow.
Um, they would call my mom to, to religious functions, marriages, and all those things in their houses.
Mhm.
As we would walk out on the street, the flower vendor, and there were rickshaws in that day where people would take the rickshaws to go from place to place in the rickshaw.
Yeah.
Right. So it was like where my mom and dad were part of this community there, and loved, respected, and valued for
Mm,
the medical service they gave. So that was the impression I grew up with and went to
mhm,
medical school. My my own medical career started out as an internal medicine physician.
mhm,
I worked in as a hospitalist for about 9 years, and then I worked as a primary care physician. And when I, as a primary care physician, there are a few things that I started noticing about our own Western system of medicine.
mhm.
Um, I felt it was very disease oriented, disease
Yeah,
based. Like
yeah.
if a patient's symptom doesn't fall into a category of a disease, I felt that I had nothing much to offer to them to
Mm,
remedy their symptoms. Okay, it
yeah,
doesn't have to be labeled, but they have symptoms, and I
right.
felt I was really falling short of serving them there. And it was, patients would always ask me, Doctor, what can I do naturally? What should I change in my diet? And, to alleviate little symptoms like constipation, bloating, gas, and indigestion. And I was like, if I couldn't give PPIs, I didn't know what. Yes, I would suggest
Mm,
diet. Don't get me wrong. Though there
yes.
are things that we use, but I felt like I needed to do more. I needed to give them more, right? So, and I kept hearing, what can we do naturally? What can we do naturally? then I said, okay, if so many people are asking me, there is something to this. So let me look
Yes.
into this. Then I explored and found this integrative medicine fellowship at the Andrew Weil Center for Integrative Medicine. And as I went through that, that filled all my knowledge gaps of what I was
Mhm.
actually looking for, or
Right.
rather, what patients are actually looking for, right? From a physician.
Right.
And I did this fellowship at a very challenging time for us
Mhm.
physicians and for
Mhm.
people in the world
Mhm.
when the pandemic started.
Yeah.
Okay, the fears, there's so many things going on in everyone's mind, and I still decided to take the plunge and start the fellowship. And as I went through the syllabus, with each chapter, I started implementing small practices. That's what
Mm.
it was, right? I started the first one was on prayer meditation, and they said,
Mhm.
try a prayer meditation for this 1 month and report back at
Mhm.
the end of the month. And I'm like,
Mhm.
okay, fine, I need to report back something.
Mhm.
I need to do it. So I started a prayer meditation, and at that time, the travel between India and US was kind of stopped because of COVID. My
Yeah.
elderly parents live in India, and there was this whole anxiety of how are they doing? I can't even go there. I picked a prayer that I've heard my mom chant as I was growing up in my native language. My
Mhm.
mother tongue is Tamil. Um,
Mhm.
and I used to started listening to that in the airport, not in the airports in the morning when I woke up,
Mhm.
as I was, getting my coffee ready and stuff like that.
Yeah.
I, miles apart, that hearing that very familiar prayer,
Yeah.
I felt the sense of connection with my mom.
Mm.
It gave me a
Wow.
lot of comfort and
Yeah.
connection.
Yeah.
And also, it served another purpose that morning is when we get up and our minds are, oh my God, I have this today, I have that today, I have so many patients scheduled, I don't know how many messages I'm going to have in my inbox.
Mhm.
Whoa. The whole, we start with the state of extreme sympathetic stimulation, right? So this
Yes.
prayer grounded me,
Mm.
calmed me down,
Mhm.
and I started with this sense of control and calmness.
Oof. I love it.
Yeah. So, that was the chapter one. Then we went on to nutrition. And, as doctors, we believe, I believe that I ate healthy, and I did to a large extent, but there's so many
Yeah.
layers of healthy in nutrition,
Mhm.
right? So I picked up few more new things and I implemented that in my home. And that benefited not only me, but my whole family, right? So
Yeah.
on and on and on, I can go. Every chapter, I just picked one or two things and I did those things. And I can tell you that it's because of these practices that I did not lose my sanity during this tough
Mm.
and challenging
Mm.
time.
Mm.
I not only was able to find that calmness and grounding, I was able to actually be present in a better way for my patients because
Yeah.
they needed my help, a lot too. And I could not have been present for them if I didn't do what I was doing. So as I went through the fellowship, and as I experienced the benefits, I decided that this is the medicine that I want to practice in the integrative medicine, where we combine treatments from, not only the Western system, we don't set aside Western treatments. We know it's critical and life saving, but we
Mhm.
combine it with treatments from complementary, alternate systems in a very research informed and cohesive
Mhm.
way, respecting the patient's ethnicity, culture, preferences, individuality, everything in a wonderful way. And
Mhm.
why not? I mean, this is the medicine that I wanted to practice. So
Yes.
I also knew that in the setting that I was working, this was not possible. So I left my job and I embarked on starting my practice in my integrative medicine. And here is
Yes. Very cool. Wow. You, Dr. Malathi, you said so many things. So many things. First of all, when you talked about your parents being family doctors and what that looked like in India. And what I will share with you is the reason that I chose family medicine was that feeling. Now, it clearly looks a lot different when I was going through medical school. but when my after my first year of medical school, what do you call it, shadowed. I shadowed this doctor, and he was in more of a rural area, and he was like that person. He was known in the community. He let me shadow him, follow him around, be on call with him. And he was known in the community, and he did pretty much everything. He didn't live work it wasn't a similar living situation, but it felt like very communal. And I just, when you talk about, that's like the real essence of community medicine. And one of the things I love about integrative medicine, which I think you kind of alluded to, is this way that um, what what integrative medicine does is it combines the best of both worlds, and it honors the patient. It honors the culture, the beliefs, all of the things of the patient. And then one other thing that I just want to underline, and maybe we can get into this a little bit, is I love how you listened when you went into the fellowship. You took each chapter and you implemented these small practices. And I think like why so many people get disempowered in their health and well-being is because it feels so gargantuan. And what you did was you modeled small practices. I just think that is awesome.
Yes, big changes happen with small steps.
Hmm.
So, just one, two, or three, and allowing to feel that change that happens in our mind, body, emotional, physical health is 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 what is it. And then once we feel the changes, then we become, oh, it's like this is working, I'm feeling better, right? So then we become more empowered, more in control. It's this empowerment. I strongly feel and believe that integrative medicine takes the power back and gives it to the person, because
Mm,
it's not that, hey, you go in and you see the doctor and the healthcare system and they prescribe A, B, and C, and that's all you need to do.
yeah.
No, it's that. Yes, it is that. And here are a lot of things that you can do yourself. You can, whether it be breath work or meditation or any type of meditation based on what
Mhm.
you have grown up, your beliefs are, what you know to be effective.
Yeah.
It is also, how we want to respect your diet, and what does your food look like, and what are the things we can incorporate in that to make your food more nutritively powerful for you, or what
Yeah.
changes do we make there, right? It's not
Yeah.
that this is the diet, you go eat it. No, tell me what you eat, and how do you cook your food, what you eat, and that it's
Mhm.
fun also. It's interactive fun. It brings out that innovate. I tell my clients, innovate, think of what you like to eat, okay, and I want you to see how you can add whole grains to this particular recipe of yours that you love to eat, right? So
Yes.
it's innovative, and it's fun. It becomes fun, then eating becomes fun, and eating becomes a true nourishment and a experience, a pleasure giving experience rather than a chore.
Mhm.
Right?
Yes.
And then mind body treatments or therapies or mind body exercises, however you want to call it, breath
Mhm.
work, meditation, yoga, tai chi,
Mhm. Mhm.
whatever else that can be. So these are all things that one can do themselves, to find, and exploring spirituality, and and also respecting the beliefs and practices. If my patient or client has a practice, a spiritual practice or a religious practice that they believe is going to help them, hey,
Mhm.
that's fine.
Yep. Yep. Absolutely. Absolutely. One of the things I love that you brought into the space is this concept of fun. And I think that when patients can begin to reframe some of the practices of well-being as being fun in whatever way that looks like. And I love the way you talked about, like how can you make the food, how can you make the food that you normally like? How can you add a little bit of this, or how can you make it healthy? Go on a scavenger hunt for recipes, healthy recipes of that particular thing. When I was still practicing, before I even opened my own practice, I was in a room with a patient. There's an older guy, Southern guy, and he had hypertension, and um, he was coming in, and I wasn't his primary. I was like filling in for the primary. And in the chart it was not compliant, not compliant, not compliant. And I asked him, I said, "Well, what is it that is having you not want to shift and change your diet?" And he said, "Well, it just seems like eating healthy is boring and hard." And so then his wife was in the room, and I asked, "Well, what if it didn't have to be? Like, what if you could eat the foods that you liked, but they could be healthy?" And they were like, "What?
Is that even a thing?
That's possible, right? Is that a thing?" you know? And so, like, we resource people in that way as integrative physicians, right? And so I love that you brought that in. I think the same could be said for exercise. People would think exercise is just going to the gym and getting on a machine. But what if it's like going for a nice walk in the neighborhood? What if it's like turning on some music and dancing? What if it's playing tag with
Absolutely.
your child, or playing
Yeah.
frisbee with your child, or playing pickup ball outside with your kiddo? Like, that's so I love that you brought this element of fun in
And
there.
I like to call it movement. I'm moving,
Yes.
I'm learning a lot of new things as I evolve as an integrative physician.
Yeah.
What I initially called as dietary interventions, I now call it nutritional interventions, right? Diet
I
is
love it.
kind of a strict thing you have to adhere to.
Right.
Exercise, it's movement, and movement has to be enjoyable for us to repeat it and be consistent with it. So,
Yeah.
yes,
Yeah, we forget, well, and I say we, but also, like, I think people in general forget that health can be fun, like, being healthy can be fun. And I think that the traditional medical model has sucked the fun out of what it means to enjoy healthy eating, and enjoy healthy movement, and enjoy mind-body practices, because that can be,
connection. Yeah.
you brought it's incredibly. I love what you said about when you did when you listened to the prayer. Not only did it facilitate this connection between you and your mom, because it was your home, it was like your home prayer from your home, in your home language. It facilitated a connection, but also it like calmed the mind, it reset the mind. And I think that people don't often realize the value of something like that until they do it. And it's
Yes.
one thing that even I do yoga in the mornings. I've been practicing yoga for 18 years now. And I sort of took for granted, I practice in the mornings before my day, but I took for granted the value of even just sitting meditation, like sitting in silence. And let me tell you, I love me some silence. I love a good quiet room. And so I started just earlier, late last year, I redid my schedule so that I would take 15 minutes after lunch, before the start of the next half of the day, to just meditate, just 15 minutes. And if I have more time, I'll extend that to 20 or 30. But most of the time, it's 15 to 20 minutes of just breathing, being with myself, and it's amazing the way that I go into the second half of the day, and even how I am when I pick up my son, like, I'm not like tapped out.
Yes.
So, that mind body, that, whether it's prayer, whether it's meditation, whether it's chanting, whether it's, reading, whatever it is, that work is crucial.
Absolutely. And initially, as we start these practices, it's important to sit down and,
Mhm,
give specific time. And
mhm.
it's like, if someone wants to run a marathon, the first day's practice starts with a brisk walking. For a person like me who, you know, 10 years ago, I was a sedentary person. So the initial practice is just getting out there and brisk walking. So
Mhm,
initially, when someone starts the practice of meditation, it's necessary to sit down and give that time and space and allow
mhm.
the focus to be on one thing, so that improves our focus and attention. But
Yeah.
also that will, as one practices that, you will notice that that translates into whatever you do. We
Mhm,
can be in this discussion just focused on what we are talking and what
mhm.
we are discussing, and that's a meditative experience. So very slowly we'll start finding that that pervades into everything that we do, and that's the whole point of those practices. It's not a discrete 15-minute thing you allot time for, but you want that to pervade into everything that we do. So yeah.
Yes. That
Yeah.
is so true. Because even what happens is when we start to practice, we say when we talk about self-regulation or emotional regulation practices and the work that I do with leaders is you practice the emotional regulation before you need it, right? When you
Yes.
practice it before you need it, then when you need it, it's sort of ingrained into the cellular network, into the neurological network. And so it's the same thing with what you're speaking about. It's like with meditation, if you sit down, and for those of you who say, oh, I can't meditate, you can. It just may look a little different. And most people think meditation is just sitting for hours and right. It's not. It's more than that. It can be that, right? It can be sitting down for hours. And for those who have that kind of time, and I know that there are people in the world who that is what they do. Like it's a practice. Buddhist monks, like gurus. It's a thing. And for some people, 5 minutes. And even if it's difficult to sit with your own thoughts, sometimes it's useful to start out with a guided meditation to help guide you into that stillness, right? So there are lots of different ways to utilize that meditations, that sitting in meditative space. But just as you said, Dr. Malathi, when you practice it when you don't need it, it bleeds into your behavior. It bleeds, it like spreads into the conversations that you have. Like even this conversation between us, there is that space of connectedness and that meditative space, that cadence, because of the way we practice. So I really appreciate you bringing that mind body into the space.
And there's an interesting thing for people who say, I can't sit in my bed. True, true.
Yeah,
I hear you. I acknowledge that. Because in
yeah,
Ayurveda, there is this interesting paradigm that, the Ayurveda divides people into, there are three basic constituencies, Vata, Pitta, and Kapha. And the characteristics are, different.
yes,
And they very clearly call out and say that the Vata people, it's hard for them to sit still. So for them,
yes,
walking meditation. The Pitta
yes,
people who are supposed to be intellectual. So for them, yes, the intellectual, the transcendental, though that meditation works. But
yes.
Kapha people, it's different. They're more compassion based. So maybe
Mhm.
something like a loving kind. So kindness meditation or something like that. So
Mhm.
yes, there are different people and there's something for everyone.
Absolutely. I love that. I love that. And I love that you said, for people who are Bata people, movement meditation. And quite honestly, I mean, when I first started practicing yoga, I was looking for something that was more movement based because my conditioning, I was an athlete and I was a gym person. And so I wanted the benefits of yoga, but the idea of going very slow was very foreign and very uncomfortable. And so I chose Ashtanga yoga because it was a movement yoga. And I experimented with things like power yoga, but it was too fast. And so I ended up landing on Ashtanga. That's what I practiced. It is a movement. What I love about it is because it's a set series. After a time of learning the series, you don't have to think about it. Your body remembers, and so then you can. But still, for me, who is Pitta Kapha, I find that I had undercut the need for the sitting still for a short period of time. So so I appreciate you bringing that. We're gonna have a whole episode on Ayurveda because I know because when I read the name of your business, Ayer, I know the roots it stands for something, and so I would love to have you back at some point and talk about because I know that's an interest of yours as well. A little bit of Ayurveda and what that is and how that relates to integrative and empowered well-being. So yeah, I want to just talk about a little bit about your practice and how you help people. I mean, we you know what? I could go on and talk to you about this all day. I think when we had our phone conversation, we were on the phone for at least an hour. And so, but I do want the audience to kind of get a sense of what do you offer? What are the types or what are examples of how you take care of your patients?
Absolutely. So I offer consultation, I integrative medicine practice, and
Mhm.
I have two areas of focus. One is cancer survivors,
Mhm.
because there is so much in integrative medicine that we can help anyone facing the cancer journey or their family,
Yes.
as they at any point in their cancer journey, along with the conventional treatments, which are the most
Mhm.
effective for cancer. So,
Mhm.
um, there is so much that we can offer to improve their quality of life, to help those facing that journey with anxiety of the
Mhm.
diagnosis, anxiety of treatment, to help with sleep, to help the common side effects of cancer treatments with
Yes.
acupuncture,
Mhm.
um, and also that's one area of focus. I feel there's so much that's that it
Mm.
is a field where, as you can imagine, we are finding out more and more and more, um,
Mhm.
and I'm really super excited to be in that space. uh,
Mhm.
and the other area of focus I have is heart and metabolic health,
Yes.
because there is with the modern lifestyle that we have, there's a lot of metabolic imbalances that leads to chronic conditions,
Mhm.
and there is a lot that we can do before we get to a point that we need to start medication. So there's a lot that we do with nutrition, lifestyle interventions, stress management, and even, and this is the very not much spoken part of integrative medicine, is also exploring one's spirituality, joy, meaning, and purpose. So
Yeah.
that's really, really very important, and that's important both in any situation, whether one doesn't have chronic conditions, or one has, is facing challenging conditions like
Mhm.
cancer, or chronic illnesses like diabetes,
Yeah.
hypertension, heart disease. So exploring, and joy, meaning, purpose, spirituality, social connections, integrated medicine is all of these things. So I I bring in all of these elements into my practice.
Yes. Well, there's research, as you well know, there's research behind improved outcomes for people who have a sense of connection to something bigger than themselves, to something, some higher power, something bigger than themselves, and have that, and also that have community around them. So people who experience this sense of joy, meaning, and purpose, whatever that, wherever that comes from, those people have better outcomes in their health and well-being, whether it's post-surgical cancer survivors. Like, there's research behind that. So I think that it's something that is not as much focused on and much talked about, but is extremely important. And I think because it can be, a sensitive subject, or for some, because it's people have been marginalized because of their beliefs, but to be able to honor that in practice, in a medical practice and an integrative practice, it's just so valuable, and it creates a space of safety in inside of the system that you're healing in. And so I appreciate that you integrate that in, because we are not just mind and body, we are mind, body, and spirit.
Spirit. Definitely. The spirit is really big in us, right? And,
Mhm.
there's also a lot of data on outcomes and positive mindset, right?
Yeah.
Especially in a condition like cancer, or we have certain beliefs based on what we've heard about what our loved ones, friends, or even somebody that we've heard has suffered, and how it's going to be, and how the
Mhm.
treatment is going to be. So it's very important to give, first of all, it's important to give space for all of
Yeah.
those things to come out, the opportunity and space for those to be expressed, explore them, and then kind of redirect, based on what they will redirect them to, to a more, where we are able to talk about the fears and have them overcome those fears,
Yeah.
And there is science research that has showed that positive mindset has, our body's immune function is able to work better with a
Yes.
positive mindset, and our immune function is very important to overcome cancer also.
Yes. Mm-hmm.
So the positive outcomes are all related to that. There's less stress, less cortisol, less suppression of immune functions, and improved immune function. So
Yeah.
yeah, there's all of these elements, and I love that I have this opportunity to bring it in and integrate it,
Yes.
in a person's care.
Hmm. I love that. I love that you brought in the positive mindset because I think that's extremely important as well. And one of the things that you talked about is beliefs. And one of the things that I really appreciate about what you said is allowing people to talk about their beliefs. Sometimes, well, first of all, we come from a very, again, once again, we come from a very fear. I'm gonna call it fear mongering traditional model of medicine, right? Scare people into doing the right thing, shame people into doing the right thing, and guilt people into doing the right thing. And it
And
doesn't,
also, if I say this, maybe am I giving them false hope? That fear also
of
makes us
course,
frame things in a different way, in a negative way for the person, whereas we can use our words a little more differently
correct.
and frame it in a more positive, not false, no false hopes, but in a very factual way that doesn't take away the hope.
Yeah, so we come from this is a conditioned model of communication, right? Based on fear,
Yes.
guilt, and shame. And it is. It's not that it's without good intention. Of course it's with a good intention because we want the best for our patients, but we it's not a very trauma informed way to communicate, right? What it is a trauma inducing way to communicate. And as you've well said, the mindset, it can impact our immune system, can impact our healing. Our body is eavesdropping on our thoughts all of the time. And so whether we think we can or whether we think we can't, we are right, as the quote goes. And so I think that, number one, giving space for what a person's experience, fears, beliefs, emotions are, like giving space to that. This is one of the things that happens in integrative practice, right? It's what you alluded to, giving space for, okay, this is what I fear, this is my belief, this is what I've heard. And because a lot of times, again, traditional model might shut that down without allowing space for it. It's a conditioned response, it's a conditioned communication. And what we can be leaning towards, both in the traditional model, but particularly what traditional model can learn from integrative model, is to allow space for, and then, as you said, redirect, or as I like to say, reframe and say, well, what if it's not that way? Here's what some other data shows. Here's what my experience has been. Here are some many examples of where that fear didn't happen, right? And these are the things that you need to do in order to prevent it. And that's what I hear you communicating, like this is the space that you bring to your patients. And that's just wonderful. Yeah, very cool. Well, again, we could talk all day about this. And I want to honor your time and space, doctor. and so and so what I'd love for you to do is to share with our audience, if they are interested in having a consultation with you, following you, learning more about what you do, how can they reach out to you? Where can they find you?
My website is www.ayur, that's AYUR today, TODAY. I'm also on in the social media. You can find me on Facebook by my name, Malathi Acharya.
Mhm.
And I'm also on LinkedIn and Instagram where I go by Dr. Malathi. And Dr. Malathi 2023 is my Insta handle. Um, uh, I offer, mine is a medical practice. So the medical practice is, for those living in the state of California. But uh, we are also planning to start a coaching, integrative health coaching,
Mhm.
for those that are living outside of California.
That's good to know. That was it's perfect because I was going to ask you that question. So if you're in the state of California and you're listening, then reach out for the medical aspect. And if you're not in the state of California, be on the lookout, and by the time this releases, it may actually be already in, already released or already launched. But be on the lookout for the integrative health coaching aspect of Dr. Malathi's practice. We will have all of your information in the show notes. So for those who are listening, driving in the car, whatever, know you can go to the show notes, and all of Dr. Malathi's information will be there. You can follow her on Instagram, on LinkedIn, on Facebook, or you can go to her website. And so, thank you so much for being with me today, for having this conversation. It was such a rich conversation. It was so informative. And I think it's whether a person is living in California or not, they're going to take away so much. And I hope that they reach out to you to have their integrative needs met.
Thank you, Dr. Maisha. This conversation has been very meaningful for me. So thank you for this wonderful time together.
Yes, thank you. And so, audience, without you, there is no podcast. And I always like to thank you for listening. And look, what I'd love for you to do is to share this episode, because this is information that needs to be out there. We need to know what are the choices that we have in our health and well-being to keep us empowered and to keep us at the source of our health and well-being. So share this with three people: a friend, a family member, a colleague. And if you if you so love this episode, which I think you should, you leave a review on Spotify or on Apple Podcasts, whichever podcast platform you're on, and let us know let other people know coming behind you that this episode, it was very meaningful and very informational, and that they need to listen as well. And finally, you know where to reach out to me if you want me to come speak in your organization, if you want me to come and educate your leaders on trauma informed communication. I'm at mindremappingacademy.com. So, with that, I leave you, and I hope you have a wonderful week. And until the next time we meet, stay empowered.